Hello, beautiful. And what I really want to know is what is good in your life today? This is Kia with another episode of the Female Veterans Podcast. So today I have a really unique and special episode. I have partnered with many of you may know already from some previous episodes with MOAA. And I get the distinct pleasure of interviewing some people who are affiliated with them. And this is one of those episodes. Now, today I have with me Kellie. She is incredible. She's got a great story, and it's a little different than what we normally hear because she worked for a public service, but not for an armed force service. So we're going to talk about that a little bit, but she's a former government employee. So same difference, and we're going to hear all about it. So welcome, Kellie.
Hi, thank you.
So I'm so glad to have you with me. And I know that today happens to be a very special day for the Public Health Service, the branch that you worked with. So what's going on with that? What's today?
Well, actually, I forgot all about it, and I got an email from MOAA. It reminded me that everybody that today is the 133rd birthday of the U.S. Public Health Service. And the PHS is one of the 8 uniformed services with the addition of the Space Force. So we're one of the 8 services, and we are not an armed service, but to give a little bit of background, the Marine Hospital Fund was created in 1798 by President John Adams to provide services to sea services, seamen. And then later it became the Marine Hospital Service. And then later the mission was expanded to provide services for the sea services and also public civilians. And in 1889, January 4th, the U.S. Public Health Service was instituted by the 50th Congress of the United States. So it's the Public Health Service.
So happy birthday, Public Health Service. We are recording this episode on January 4th. So it's probably, if you're hearing it, it's probably a couple of weeks after that, but still happy birthday to the Public Health Service. I think it's really interesting that it was started by John Adams, number one, because that's quite a long time ago. And number 2, for sea services, seamen, because I was a seaman in the United States Navy. And of course, we took care of our Marines, as you know, and we love our Coasties, the Coast Guard, which is, as I've been learning from interviewing Coast Guard female veterans, it's quite similar to the Navy, which I had no idea before. So I think this is really cool. Now tell me, for anyone who doesn't quite understand what the Public Health Service exactly does, what do you guys do there?
Well, the Public Health Service provides, the Surgeon General of the United States. They oversee, they're the top of the Public Health Service. And you see all those Surgeon General warnings. And we wear a uniform. The uniform looks a lot like the Navy uniform. The insignia is what's different. The ranks are the same. All of that's the same. But the insignia, we have the anchor and caduceus, the medical, versus where the Navy is different. But really, that's what we do. And there's some engineering, but dentists, doctors, all the medical fields that you can think of, and then sanitarians. And there's a few IT people that slid in, and I was an IT person. I don't know that they're bringing in IT people anymore, like for the health IT stuff. So I got in under the information technology arena, but it's really a medical service corps, a medical corps that's under the Health and Human Services umbrella. And it is a uniform service, and we retire, we're veterans, we can have our VA card, and that's how I got to know MOAA a long time ago when I worked in Commissioned Corps personnel. And so that's when I learned about MOAA and saw the magazines, but I really didn't know that much about it. And then after I left the Public Health Service, then I started getting more involved and paying more attention. And then, now 5 or 6 years later, I'm a lifetime member, and I'm reaching out to them a lot for guidance. Yeah, they're a great organization. But I don't know if that makes sense. Does that clear up what the PHS is?
Yeah, I mean, I didn't realize you guys were a uniform. And It's medical.
Yeah.
So I was a hospital corpsman. So I really connect to the mission there. And I imagine that everything going on with the pandemic is sort of being monitored through this organization, and all of the information we're receiving comes from them.
A lot of it does. Now, interesting, Dr. Fauci is retired public health service officer.
Oh, okay.
A lot of people don't know that. Yes. So he was. And yeah, and I actually kind of feel bad for some of my PHS colleagues that are still in, because they're just deploying around the clock. There's like not a lot of rest for people. They're just deploying, because this pandemic is leaving so many. See, what happens if something happens like a hurricane or a pandemic or a bombing, like World Trade Center, the states request funding and services from the federal government. And a lot of times, and if it's medical needs or psychiatric, we send sociologists, like psychiatrists, we send people like that out when there's school shootings to go into the community. So they request help and funding, and then we send people on deployments to go to those areas. So our PHS, like a lot of nurses, they're just around the clock. They're just deploying. When that first cruise ship came in, when the pandemic happened and they were coming in Southern California, PHS went there to help out and stand up and meet with them and help oversee a lot of that when we didn't know anything about really what the pandemic was.
Wow. Yeah, I can just imagine. And so much round the clock work. I mean, especially now at the time of this interview, Omicron is the big new variant we're seeing spikes, and we're seeing concerts being postponed now. And we're seeing it's giving you like PTSD flashbacks to the beginning of the pandemic, I think a little bit. So I imagine that the public health service will be continuing to work so hard, and maybe even harder around the clock, until this new wave is back under control. I guess they're calling it a surge. So, and I'm familiar with that because when I was in the Navy, every summer we would have what they called recruit surge. And those of you who worked in services like I did, in the hospital, in the pharmacy, which is where I worked, you would see an influx in patients and that all of that, because of all of that additional recruiting that happens, that funnels through in the summertime. And it had to be managed. And it was around the clock and a lot of work. And so I can just barely imagine how hard everyone is working in the public health service right now.
Right. Because this is all hands on deck. And a lot of the people who are deploying, their day job could be researching and trying to get their arms around what this is. And then they leave their desk job, and then they go and deploy, and then they come back to their desk job. And PHS doesn't do a very good job of marketing themselves. There's not a lot of marketing funding, and people don't know about it. But we had PHS people deploy for Ebola. Remember that outbreak several years ago? We sent people there, and when they came back, they had to quarantine in hotel rooms for 2 or 3 weeks by themselves, and before they could go with their families, because they didn't know really what Ebola was. And the tsunami in several years ago in Indonesia, somewhere in the Pacific, one of those islands, the Bali, I think, the tsunami.
Yeah, I remember that.
There. And people have gone over to the Middle East and worked in the hospitals and helped with some of these countries building up their hospital systems after the military went in and did their thing. And PHS is there with them, helping them side by side, but from a medical standpoint, working with the local governments and hospitals there.
Wow, it's amazing work. Definitely every bit as necessary and valuable as active duty armed forces work. What kind of training is required for you? Because we go to boot camp, but I imagine it's quite different.
It is different. In order to get into public health service to begin with, there's certain categories like dental, nursing, and engineering. There's certain categories, and then you need a specific degree to apply and then get a job. And where we're different from the militaries that kind of have to find our own jobs. When you want to move around, you find your own job. There's not a recruiter or someone who's going to tell you when, a detailer, where to go when it's time to move. So you have to have a certain degree, and you have to find a job, and then you apply, and then you can come in the public health service. So that's how you get in. And back when I got in, really it was, you got mentored by senior people, you got paired up and mentored. Now they actually have Basic Officer Training Academy, and it's a classroom academy. And so I think there is some PT involved now. I can't even speak to it because I didn't go through it, but I think there's a lot more involved now, but it's a Basic Officer Training Academy is what they call it. And it's needed.
I would imagine so. And I would think that physical readiness would be a part of it, PT, because of all the deploying that you have to do to places overseas, just like we do in the armed services.
Yeah.
Yeah, it's really interesting, the difference there.
But when I was in, we followed the Air Force for the annual, like the PT requirements to show that you can run in a certain amount of time or swim, the push-ups and all that. So we followed the I think it was the Air Force guidelines, and then they switched over to the Army. So there are annual guidelines. It's just a lot of it is not as structured as you would get in the military. But we had to sign off that someone had to watch us do it. We can't sign our own test, but somebody watched us and then signed off and submitted it. So there is that piece of it.
And you are all officers, but back when you went through, there was no like field training or you went OJT. So that's how I learned pharmacy.
Yes.
Instead of going to C school, I went OJT. So I'm for that. I think it actually works even better than book training, right? If classroom training, because it's very hands-on. I mean, I think if you're that kind of learner, which I certainly was, working with people and learning on the job was always my favorite way to learn a new skill. And how long did it take you to be trained and ready to take your job completely on your own?
It was, in most situations, it's really like any other job. You go in. And so when I went in, there were 3 of us that were new. So we kind of worked together, and we had an engineering PHS supervisor who supervised us. And then he oversaw, we really just hit the ground running. And we did have some on the job training, like he, showed us how to do some stuff. And, like I didn't know how to, we had to wire cables for a network, for a Banyan Vines network. And he showed us how to do that because he was an engineer, but it was like he showed us how to do it and then we did it. And then the next thing he showed us how to do it and then we did it. So it was just kind of like that. So we really hit the ground running. And then while we're doing that, then we're learning about the whole public health service, how to wear your uniform properly and all that stuff.
Wow. So how many years were you with the service?
25.
That is a good long time.
Yes.
So tell me about some of the experiences you had while you were on, let's say, active duty.
Right. It was good. So my job experiences were good because you have to, in the public health service, you really have to own your own career. So I changed, I was always looking ahead because I knew to get promoted, you had to keep moving up and do things. So I was always looking ahead, and I used part of my GI Bill to get my master's degree, which was kind of a big deal for me. That took time. But my deployments, I had over 15 deployments. And, of course, when you go on a deployment, it takes time away from you. You're not at home. You're not in your routine. It's stressful. It's chaotic because we're going into a hurricane situation or 9/11, whatever. But those were some of my most fulfilling times. And I made so many friends there, and a lot of us still keep in touch. And
that's amazing.
So those were good. The hardest one that I did that was emotionally hardest was deploying to Hurricane Katrina. And I went about a month after it, and then just seeing what happened down there, that was tough.
I can just imagine. Even seeing the footage after Katrina was like, took an emotional toll. I mean, you had to maybe lack compassion or empathy if you felt nothing when you saw even the footage. So I imagine seeing it firsthand must have been impactful.
Yes. Yeah. And the buildings, and I went there, we had like around the clock deployments for a while there. I think, most of the Corps deployed with that one. And I went a couple weeks after it. And so then they were in cleanup mode and stuff. And it was just seeing the buildings, the vacant buildings, and how they painted the squares on them to show Did they find any people? Were they deceased?
Oh,
were there any pets? It was tough. Yeah. Just seeing it, and I wasn't even the one doing it, but just seeing that big, vibrant city empty. It was tough. I'm getting chills now.
Me too, because it's so crazy. I remember after 9/11, I lived in Chicago, and I actually worked in the Merchandise Mart, which is the apparel center, and it's kind of downtown. And I remember I had a trade show, and it happened on that day, and I had to go downtown to get my stuff out of my workspace so I could go home. Like that was just how it had. So we had to go back to the workspace. And I remember how empty the streets were in downtown Chicago.
Yeah.
And it was so creepy. It was a very eerie, just unsettling feeling that I will absolutely never forget. And so I imagine it must have been quite like that. But knowing that the tragedy actually struck there, because obviously I was in Chicago, not New York. So it hit differently, I guess I'd say. That's incredible. And what was the work that you had to do down there during or after Katrina?
So when I was there with Katrina, I did more of a support role and, being in IT. So I worked with the medical director, and there were some civilian nurses that were there with us. So civilians, there's disaster medical assistant teams around the country. So we had civilians, we had PHS, and I was involved with trying to organize the field medical units that were going to go out and where they would go out. Because at that point, people in the field, they didn't have hospitals, they didn't have doctors. So people who were there would go to these tents, with medical tents to get their care. And so I was helping coordinate who was coming in and who was going where. And what's interesting, kind of a funny story, I grew up in a small town in West Virginia. And I got there. So I showed up, I'm checked in. I'm like, yeah, he said my name. I'm checking in. And then this guy turns around and looks at me and he goes, Kellie. And he's in uniform. And I said, yeah. He goes, it's me, Scott. I grew up with Scott. We went to the same church. We went to the same high school. I mean, in our town probably has 5,000 people in it. And there we are. He was the medical director. And there we were meeting up. And I had no idea he was in the PHS. He didn't know I was in the PHS. And he just turned his head around. And this is, 20 years after we graduated. Maybe not that long. But yeah, that was kind of a funny story and a neat story. So I took our picture. My aunt put it in the little local paper.
Oh my gosh, that's such a great story. I actually, ironically, had something similar to that happen to me while I was serving in the Navy. I ran into I went to a private school called Milton Hershey School in Hershey, PA. And this was kind of a small town. And I ran into one of my classmates from my graduating class, 94, class 94, shout out. And he had enlisted in the Navy, and he was I think he was on his boot camp final weekend where he had finally had liberty, and he had come to the mall, and I happened to be at the mall. And we ran into each other in the mall. He was in uniform and I was in civilian clothes at the time, but he recognized me right away. And I saw him, I was like, oh my God. And so for like 5 minutes, we chit-chatted and everything. And then he had to go. And then we connected years later again. After he went to the CIA and all sorts of things. But years later, we ended up connecting again for a while. But it's a small world sometimes when you're in the uniform.
Right. Yeah. And my classmate, Scott, so he's in uniform. He was the medical director for the deployment. And then his day job is he's stationed with the Center for Disease Control in Atlanta. He's an epidemiologist.
Wow.
Yeah.
Wow. That's a guy.
So that's the type of people. A lot of the public health service people have 2 and 3 of these like big time degrees.
That's incredible.
I have an IT degree. I'm different, but yeah, he's an epidemiologist and in Atlanta for CDC. To where a lot of the Health and Human Services agencies is where we get stationed, but also Bureau of Prison, Indian Health Service, NOAA. I know some people on Coast Guard. We help out the Coast Guard. We deploy, detail people there.
Incredible.
Yeah.
You guys do a lot of good work. I knew some of it, but I didn't know the extent of how much great work that you guys do there. And so in your career, you got to go and help out after Katrina. What were some of the other stories that you had?
You know, a lot of it was I started out on a disaster medical assistance team that was PHS and a few civilians. And it was really just us. And a lot of those people I'm still in touch with. And that was 20 years ago. And if there was any kind of a hurricane or any kind of anything, a lot of times we would get called and we would go and deploy. But early on, what we used to do every summer is we would deploy with the Army National Guard of Virginia. And we would go down in the mountains in Virginia. This is our DMAT team. And we would actually set up a medical tent and provide medical services to them when they needed it. But it was also training for us. It was showing us how to go set up if we get in that kind of situation. How can we set up a tent? So it was our training too, but we were actually legitimately providing medical services. And it was hot, it was in the summertime and it was really, really hot. It was like 100 degrees. I felt 100% humidity. And one year there was a visiting British troop, a group there, and British Army, and they were there, and they're not used to that kind of heat. And they're wearing their thick, they don't have summer, so they had thick uniforms. So a lot of them were dropping and they would come to our clinic and have to get IVs because they were just overheated. Yeah, but that was always fun. So that was kind of a given. We did that every year. So that was fun. And it was a learning experience too. And then that prepared us for them when they expanded and PHS created the Rapid Deployment Force teams. And now there's 5 or 6 teams around the country. So it's not just our one little group. And when the anthrax, and then they were passing out in DC because that whole anthrax scare many years ago.
I remember that.
The government was passing out, I don't know what to call it, antidotes in case you got infected with anthrax. They were given out to the public. So I went down and helped out those clinics. And for what they assigned me to when I was down there was keeping track of the databases and keeping track of who was getting what and who came in. And then I noticed some discrepancies. I remember asking them well, this person's been here 3 times. And they said, yeah, well, each one of those pills is worth like $20 because it was paranoia. So people were getting them and then going and sell or getting them for their family members. Yeah. So they didn't, this paranoia. So I did stuff like that.
Wow.
Yeah.
That's really interesting.
Yeah.
I didn't think about that.
Yeah, right.
Because I remember the whole anthrax scare and the paranoia with anything like this. People get super panicked in the public. Yeah. So a lot of the public, I should say. So I can imagine there was a pretty penny to be made. And I certainly would want to get pills for all of my family.
Yeah.
I might not want to sell mine.
Yeah, exactly. You can see why people do that. Yeah.
We were really scared.
Yeah.
So what are some of the challenges that you faced over your years?
In the PHS?
Mm-hmm.
A lot of it was we do have to go out and find. We don't have the assistance of a detailer. Now, I benefited that I did a 4-year tour with personnel. And when I was in that role, I was a career counselor kind of a person. So I learned a lot in that role because that was in the DCP personnel office, Division Commission Personnel Office. So I was able to kind of learn the ins and outs and what you needed to do to get promoted, which a lot of it was you had to do the work. But if you don't document it properly in your OPF, your official personnel file, the promotion board's not going to see what you did and you're not going to get the credit. So the challenge was keeping that OPF and is how to get that knowledge out to everybody. So I was just fortunate that I had a really good mentor when I first came in, my very first supervisor. And then when I worked in DCP, I had very good mentors. And I was able to carry that. And so then I tried to help other people. But it's, that was difficult to get that coordinated message out to everybody. And when you're ready, I wanted to leave. I wanted to move to a different area, but I couldn't find a position outside of the DC area in IT.
Oh, my goodness.
Yeah.
Yeah, I can see how could that be a challenge? I never thought about that, me having a detailer. Granted, I was stationed at Great Lakes the entire time I was there. I didn't go anywhere. I didn't deploy. But Pat.
And it's good and bad. A lot of people leave the military and transition to the public health service because they don't like being told where to go and when to go, where to move and when to move, that life disruption. So in a way, I'm not portraying that as a bad thing. It was a challenge, but there can be worse things, Yeah.
So my last interview in partnership with MOAA was with Pat, and she spent some time as a detailer and was really good at it. And so hearing her stories, I could see the benefit of having a good detailer, but I can also see what you were saying about transitioning to PHS from the military, because you don't want to be put somewhere or have to go through all of that.
Right.
So
then the challenge for me was a lot of the people who I worked with were civilians. So when I deployed, let's say if I do a 2-week deployment for Hurricane Katrina, let's just say, and then, or anywhere, the other people in the office have to pick up that extra work. So then there was that guilt when you come back in the office, like, oh, you're away on a vacation. Well, it wasn't a vacation, but you kind of feel that. Mm-hmm. So we didn't take the time off that we needed. Like I came back and would go to work the very next day. I didn't get that break because I'm back at home, so now I can go back to work. And then there was that little bit of resentment, and it could be, I think some of it was legitimate resentment, but some people did know, but it was like, oh, well, you are off on vacation and now you need to be at work. And what if someone was deployed and then they had a vacation scheduled 2 weeks later? If anything, we should have gotten at least a couple of days off, but it was a lot of, and some of that, it wasn't consistent. We didn't have that kind of consistency, because some people might come back and tell their supervisor, look, I just got back, I need a couple of days off. And then they would have said, okay. Other people came back and just jumped right back into work.
I guess it has to do with how much you cared about what other people thought.
Right. Yes,
and I don't care what anyone else thinks. I'm going to prioritize my own needs. And if I need a couple of days after a deployment and I have that option, then I take it. But if you really care about what your coworkers think, or perhaps you're empathic and you care so much about what they've been going through while you were gone, you sacrifice that and you try to do what you think or feel is best for the team in that way.
Or what your supervisor, because they give you your evaluation, which is so important for your promotion potential.
Ooh, girl. I think you just called it out.
Yes.
I can understand that. I think that in the military, a lot of people can identify with not taking leave or additional time off or coming back earlier, doing these kinds of things based on wanting the favor of a superior. Mm-hmm. So that's something I've seen. So I can identify with that a lot. And I'm sure a lot of people listening can as well.
Mm-hmm. I've seen people jump to work right after surgery and not take their 6 weeks to leave. They're at home or they're in the office. It's like, oh no. I
did that as a mom. I had my kidney out, but I had a baby. So just like a week after having a nephrectomy, I was kind of watching my toddler because I had to. I didn't have a choice. So definitely there are circumstances where you jump to it when you...
Right. Yes. Mm-hmm.
And the supervisor that I was trying to make sure was I had their favor was my toddler.
Oh, right. And now that's a priority.
Yeah, for sure. I'm sure my ex-husband now, at the time, was very happy that I started doing things sooner rather than later as well.
Right.
So I'm pretty sure he was impressed. I earned his favor with that one too. And I'm sure a lot of women can agree with your spouse and doing things like that. Sometimes you do those things just to have their favor as well. Right. So tell me now about your transition, because I know, speaking of spouses, you were away from your spouse almost all of the time.
A lot of the time, right. Mm-hmm. Yeah. So when I transitioned, I was already thinking about getting out, but honestly, my spouse is in the Coast Guard. And I thought for sure, because the Coast Guard, a lot of times as you move up in ranks, they kind of alternate tours a lot of times with DC. And a lot of people don't want to go to DC headquarters. Well, she put in for it because I was in that area. So I thought, she's going to get DC and I'm kind of ready to retire. I mean, the job has just gotten overwhelming. And then she got Key West. And so I said, I'm not staying in this job in Rockville, Maryland in the wintertime when I can go to Key West. So that made my decision for me. And I was already thinking about it, but I hadn't done any preparation. So I put in my retirement papers and 6 months later, retired to Key West. So I didn't get everything done, but it was just chaos. So I left my job. I left a lot of my friends that I had known for many years. I sold my house and gave up everything and then went to Key West, which is a dream come true. But then once I got down to Key West, then I'm doing like a lot of the VA stuff that I didn't have time to get done. And so we ended up only being there a year. I thought we were going to be there 2 years, but we ended up only being there a year. But getting Key West and being able just to leave that hectic, chaotic environment that I was in. And really, I don't know if people haven't been to Key West, it's like a Caribbean island. I would forget that I was in part of the United States. I would say, I got to drive up to Florida to do whatever, go to the VA hospital. And then she would say, we're in Florida. You would forget because you're closer to Cuba than a Walmart. And so I went down there and I just zoned out. I just checked out. I didn't watch the news. I just pay attention to local Key West stuff.
Sounds fun. I mean, the closest I got to Key West, living in Miami, was Isla Mirada, and I loved it there. Mm-hmm. And I still have yet to make it to Key West, but I hear that it's easy to just check out and chill out.
Mm-hmm. Yeah, and it was nice there. But then as I'm going through all the VA stuff, I kind of kicked myself because here I am, and that would be like a dream come true for people. You get to leave your job, go down there. But then when I went down there weren't really jobs down there for people because it's so touristy. So it was hard to get a job. I'm going through all the VA stuff, driving to Miami. And then I was a little bit lost. Then I'm kicking myself thinking, why do I feel down when on paper, if you look at what I've just done, that's a dream come true. Mm-hmm. But I was like, I was a little bit lost. And it's hard to make friends in Key West because it's so transient and there's not a lot of people there. And it was different. And then I thought we were going to be there 2 years. And because the detailer said, to the Coast Guard detailer, you're staying. And then during the whole process, that 2 week that the detailers are meeting, someone in Memphis retired. So then they called and said, no, you're going to Memphis. So we were only there a year and then we went to Memphis for 3 years.
How did you manage to keep your relationship on solid ground when you were hardly together while you were in?
It was hard. So one of the strategies that we did was she did have several tours in DC. So that helped. And then a lot of her jobs that she put in for and she got was on the East Coast. So we were a 3-hour flight, usually from anywhere at most. I mean, when she was in Long Island and Buffalo, it was much shorter even. So I could just fly back and forth pretty quick and go and do the weekend. So we saw each other at least once a month and we didn't have kids. And that made it a lot easier. I think that would have been a game changer and would have been different. But since we didn't have kids, that's how we did it. And we actually met in Puerto Rico. I went to visit a Coast Guard friend in Puerto Rico, and that's how we met many years ago. Oh, wow. And then used to be able to space safe fly. Remember when from Puerto Rico to Walter or Andrews, and then they closed down the base in Puerto Rico. But I did several flights down there, which was nice.
I can imagine.
Yeah.
And then through your transition out, as you were saying, you were feeling a bit lost and you were having to drive up to Miami and deal with all things VA.
Right. Yeah.
And trust me, I know the VA healthcare system in Miami is not the best and easiest to navigate, we'll say. So I can feel your pain. How did you manage to get through all of that period?
Well, a lot of it was I got help from, just odd people gave me advice, people who went before me. And one of the best advice I got, and I wish I knew his name, I'd give him a shout out. I was sitting at Boca Raton listening to live music, one of the Navy, because they have like 3 little Navy bases, the air station, and listening to live music at the marina. And I was sitting next to this guy, and we got to talk, and he was retired Army, I think. And I said, oh yeah, I'm going to go down, I got to go to VA. And he goes, here. And he told me, and I can't remember what it was, what to Google and look up. And he said, use your VSO, get a good VSO, Veteran Service Organization rep and help, and they can help navigate all of that. And so different people offer different advice really when I needed it, so it was good. So that helped. And then when I would go to the Miami VA, I have to say, because I was going there I wasn't really going there to get care. I was going there to get the physicals and all of that.
Right.
It wasn't bad. Wasn't bad at all. And the VA is a lot better, I think, now than what it was in the past. It depends on where you're at.
I think a lot depends on where you're going to be seen, who the physicians are you're going to be seeing.
Right.
All of those logistics make a very, very big difference.
Yeah. And the inequities too, because like Memphis, their VA gets a very bad rap. And so everybody told me, don't even bother with Memphis, get all your stuff done in Florida. And when you go to Memphis, and I'm lucky, I'm still on the TRICARE Prime, from the active duty TRICARE as a dependent. So I'm just on that right now. And then and having spent decades with military healthcare, that's one of the things that stresses me out. But I know I'm over stressing because everybody does it. They figure it out. So we should be able to figure it out. I know I'm over stressing about, there's too many choices because I'm not used to having choices. You just call the TRICARE number or whatever number and you go.
It is a big change. And that's one of those things about sort of navigating civilian life. Right.
Yes.
And figuring out all of these little things. I think you need all of those helpers along the way, the people that lend a helping hand. Definitely. I've received them and I've given them over these years since I got out many years ago now. And it's necessary. It's necessary if you're going to thrive in the civilian world. And now you are a military spouse, at least for a few months more.
Right. Yep.
And I noticed one of the things you said was that you noticed how, as a military spouse, that there's underemployment in that community.
Right. And I knew that, but then I really felt it. And especially if you think about somebody, if they're moving around every couple of years, they're dropping their job again. And so even if they have great skills, but they're not moving up in an organization. So when I went to Key West, even back then, not that many years ago, there wasn't as much on, obviously the pandemic changed everything, but even before that, there was more teleworking and stuff. But when I went to Key West, there weren't a lot of jobs. And so I thought, maybe I'll get a job at the university teaching or something, And then I actually had one of my supervisors contacted me and said, you can set up an LLC, because that's what he did, and be a business development agent because of the stuff that I knew in FDA, and it's part-time, and you can do it from anywhere. And again, that advice just came out of the air. He called me up and I'm like, okay, let me do that, because I wasn't doing anything else. So I did that, and that was very part-time, but I'm still kind of doing that a little. I don't have any clients at the moment, but that's what I've been doing the last 4 years. But yeah, and then even when we went to Memphis, I was like, well, I could go get a full-time job somewhere, and I could have, and then we would have moved again. But I had the LLC set up, so I just went with that and just kept that going, and knowing that wherever we go next, I'll take that with me. But yeah, the moving around, and what I realized too, like certain fields, as they move from state to state, I do believe we should have, like, I don't know if it's teaching is what I think it is teaching. You have to get a license in every state. Well, come on, if you're a military spouse and you're moving around, why do you have to pay and take the test or do whatever, all these extra hoops to teach that, so it also takes money. Yeah. It takes money for them to get a job where they're making less money, because they're not staying in one school system or healthcare system or whatever. But yeah.
I mean, I feel that on so many levels. Like when I got out of the military, I worked, like I said, I did OJT in the pharmacy, but I knew my job well enough to be a pharmacist. This is what we did. This is how we were in a tech in the pharmacy. And the Navy does the same exact job as the pharmacist does. I counted narcs, I dispensed meds, I filled prescriptions, I counseled patients, all of that. Okay. And I was 25 years old. Now, had I got out of the military and been able to take maybe a national exam and qualify, I may have stayed in that career and I might have been still doing it to this day. But because I knew that when I got out, that I was not going to be able to get the same job unless I went and then studied and got a degree for a job that I had already been doing for over 3 years. It was, I pretty much had the degree. I've been doing the job for 3.5 years. So I can relate to that a little bit of a different way, but I can really relate to that.
It's the same. And that goes back, I think that speaks to when I took my TAPS class at Walter Reed in Bethesda. We had a very good instructor who came in and was talking about post-employment and about doing your resumes. And now I get to do like a transition 2.0, now I'm transitioning a second time. But at that time, she gave us good advice on our resumes. And she said that only 1% of Americans are military. And I don't know if that's exact, but it was a very low number, but I want to say it's 1%. And then if you think about it, most people who are in the military, they've got cousins and brothers and sisters, they know people. So the actual clump of military knowledge is small in the United States. So when people get out of the service, a lot of times what they have, it's hard to get that to translate to civilian life and have the civilians understand it.
Oh, absolutely.
And then even the military people, like I know people who've got great jobs, they're like, oh, I'm not qualified for anybody. And yet, well, yeah, you are. They don't feel like they have the qualifications, but they do. But then that 1%, it's even a smaller clump. And I think that speaks to what you just said about what you did in the military and then the type of job you could get outside of the military.
Absolutely. Completely changed the trajectory of my life. Not complaining, but who knows what could have been I think just in the civilian world in general, more acknowledgement. It's still astonishing to me how military training is not considered the best training. On the civilian world, I'm not going to go on my soapbox. I promise.
I've got thoughts on that
for like a whole nother hour. But it really is astonishing to me and disappointing. And it has been since I got out of the military to see. And I got out before 9/11. I didn't, there was no thank you for your service when I got out of the military. There is now. So I feel like the next phase, aside of more support for veteran-owned businesses, and is why the government itself doesn't institute any of these changes. Like a simple national certification could help spouses and veterans coming out, to be able to stay in their field, go into their field and make it easier to transition as we're moving around.
Right. And how many decades have they been talking about it? Yeah, exactly. Yeah. And that shouldn't be that difficult.
Yeah. And it's the strangest, saddest thing to not know if it would ever change in our lifetime.
I know. Yeah.
And it's odd, but I have this conversation with female veterans. We talk stories on this show, right? We talk stories, but I hear the good and I hear the bad of serving. And not everybody has a good experience. And it's alarming to me that some of the things when I interview a guest who served in the 70s experienced as a female serving, and a girl who got out in 2019, you know what I mean? And may have had a very similar or the same experience.
Right.
It's surprising how slow things are moving to get better. But I mean, we do see the strides they're making with the Brandon Act and the Vanessa's Act. So we see things slowly moving, but will it get to the point where it should be in our lifetime? That remains to be seen, you know?
Now, one quick story about a spouse. To give a kind of a shout out. This was a win. So when I joined active duty, I was in West Virginia. So I had West Virginia as my residence my entire time. So then when I get out, I didn't move back to West Virginia. So then I start following my spouse around. Everywhere we went, now that I'm a spouse, we went to Florida. I had to get a Florida driver's license. I had to vote to Florida. I had to do all that and register the car in Florida because I couldn't use the Texas. So she's a Texas resident. I could not use that. Then we go to Memphis. Then I got to change all that. And so that's added expenses. So not only are the spouses underemployed, but that could be thousands of dollars a year to do, just depending on the state. And then while we were in Memphis, and I don't remember the name of the law, but a law came out that said spouses can take on the home of record of their military person that they're following around, and then you don't have to do all that. So I switched my stuff to Texas. So now that I'm in Hawaii, I didn't have to go through and make all those changes.
Wow. And it's not even something I ever really thought about, but that can be so costly. I remember moving from Illinois to Florida and the difference in changing all. And I was like, why is this so expensive here? Yes. And then moving from Florida here to Washington State, vastly different. It was like a relief. It was like, why is this so inexpensive?
Yeah.
You know what I mean? Yeah. So, but when you're moving from place to place to place, those expenses do add up. And if you're having trouble working or you can't find a job, that stress can be really overwhelming, I imagine.
And then it can make the taxes stressful too. And then you got to pay for a CPA because what state do you do your taxes? When you got a spouse who's one resident, you're another resident, and then you're working, and then maybe it's it's an underpaid job for what you can do. And now you even need help with your taxes. So a lot of that adds up. But that was a big win. To me, that simplifies life. And I think some people may have already been able to do that. Like if they were married and living in the state when they joined, I'm not sure. There was a caveat, but like for a lot of people like me and a lot of people, they didn't have that as an option. And now that's a big one. That simplifies life and saves money. So it's the simplifies stress and saves money. And maybe some of these other things will follow suit.
Hopefully.
Right.
I want to ask you before we wrap it up.
Okay.
One question about your LLC. What are the services that you provide, just in case someone listening might need them?
So I provide website development. That's one of the new things I'm getting. I've done website development most of my career, but now I'm getting into that. Like for small businesses, I think that would be a fun project to help small businesses with their website development. And I recently passed my Certified Information Systems Security Professional test. So I'm waiting on the certificate. So that's kind of a big deal. So with that, I can help out with cyber planning, like companies with their business continuity plans. And, there's just so much under that CISSP umbrella. So anything like cybersecurity, planning, strategy, website development. And I'm meeting up with some people to try and team up. So if we have projects that we can work together on, if we get a bigger project or sub to some bigger companies, if they need subcontractors. Yeah. So IT stuff. And, I went to a online career fair for MOAA. So MOAA recommended, the person I was talking with, he goes, try it, just see what it's like. And I talked to somebody. So cybersecurity, there's 200,000 vacancies for cybersecurity in the United States. And they are actively recruiting veterans, spouses of veterans, and minorities because now they're desperate. They need to fill these jobs. And those are untapped diversity, untapped groups of people. And a lot of places are offering free training. And the VA is offering free training to spouses and veterans for certain certifications.
That's wonderful news.
Yeah. And it can be like entry level stuff if people want to get ethical hacker or, what I got was more of a higher level. I use my GI Bill to fund that. But yeah, that's something if people have an interest in that, there's definitely a need across the United States. I learned that from MOAA.
That's a bonus. And I got to say, I love that organization.
Me too.
Tell me, with MOAA, you've been working with them and they've been able to help you. What are some of the things that you would recommend?
Oh, for MOAA?
Mm-hmm.
Definitely have them look at your resume, because I did the resume the first time I went through the TAPS program, because she had us, we did it during class. And I thought, okay, it's good to get. And I sent it to MOAA a couple months ago. And he was very polite. He told me all the different recommendations. And he didn't say your resume is terrible, but he did say you won't get a job with this resume. And he told me all the ways to change it. So have them look at your resume. They offer a lot of help with that, and just job sources. And I used them when I was in, Memphis. I had more time. I would go and see what they were looking at from, what bills they were looking at and what they were pushing. And I would contact I would look at, oh, this is important to them. This is why, and they spell it out. So if you want to be active politically, they make it easy just to contact your representatives.
I love the organization. I think that they do so many wonderful things for the officer community, and they can certainly send you, if you were not an officer, they can certainly point you in the right direction for the support that you need. Pat was here and she interviewed recently, and she works with them and talked a lot about it. So you can check out that episode for more details. But as Kellie pointed out, they're really helpful and they do a lot of good work. And so if you are an officer listening and you would like some support, definitely you can reach out to MOAA. That's the Military Officers Association of America, and they will support you. And if you're not an officer, they can get you in the right direction of where you need to be to get the support that you need. So we love them, and I'm so glad to have partnered with them. And is there anything more that you would like to share about MOAA before we wrap it up?
Oh, and one of the things that they did recently, so when we leave here, we're in Hawaii right now. Mm-hmm. So when we leave Hawaii, we're going to go to San Antonio, and that'll be our final, that's where we're moving to. So MOAA, when I contacted him, the very next day sent me emails virtually introducing me to different people who live in San Antonio. So I contacted them and had phone calls with them. And then I asked them, these are volunteers, but they're affiliated with MOAA. Mm-hmm. And they talked about the job market. One lady, I asked her, but I said, do you mind me asking about your healthcare? Because, that's stressing me out. She told me where she's getting her healthcare, and basically now, okay, I'll figure it out, and where to go hiking and where the golf, she told me like a lot of the stuff to get acclimated in the community that you're going to. Now, San Antonio is a huge military town, so that helps. They have people there. But just the networking, as well as career guidance and healthcare guidance. And my friend's husband, he gets, and I don't understand a lot of the Medicare stuff, but he gets some kind of extra Medicare insurance through them, and Medicare Advantage. I can't remember what it's called. But yeah, they do so much. Yeah.
They're incredible. If you would like to find out exactly how incredible MOAA is directly and learn more about how MOAA helps service members, go to their new landing page. It's moaa.org/retirement-resources. That will be listed in the description box, where you'll just scroll down, find the link, copy and paste it, and you'll be taken directly there. And I will tell you, I know that your wife is going to be retiring here soon. Mm-hmm. What is it, 6 months from now?
Yeah. Uh-huh.
So congratulate her for me, and then send her my way, because she will be eligible to be a guest on the Female Veterans Podcast. And I can't get enough stories from females who served in the Coast Guard. So I will be excited to hear her story of service.
All right.
I want to thank you so very much for being a guest on the Female Veterans Podcast. And I always ask my guests one final question, and that is, what advice would you give veterans who are on their journey right now from your experience?
I would say pay attention to mentors, informal and formal. They're everywhere. People like to help. And if you go and ask the question, they'll help. And sometimes they just offer it when they find out what you're doing and what you're going through. And, it's stressful in the military and in the services. And when I was working, I had numerous coaches and people tell me to meditate. And I'm like, I can't meditate. Well, when I was in Key West, I found myself so kind of stressed out and down when I'm in this, it should have been imperfect. I got a book and started learning about meditating, and I took a class in Memphis. So now even 1 minute a day is better than nothing. So I would say meditate, use your VSO, use your resources, because we don't even know what benefits are out there. But they're out there. Like, I would not have known about the cybersecurity stuff, but I stumbled on that talking to the guy at the hiring fair. So just talk to people, listen to people, use your veteran service organization, hook up with one, people who've gone before you, ask them what worked and what didn't you know about, because we don't even know what we don't know. Mm-hmm. So, ask people, what did you not know that you wish you did? That kind of stuff. Those are some of the big ones that I would say. And just keep an open mind. And it's hard to slow down when you're go, 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 go. It's harder to sit back and just cruise into retirement than what you would think. Oh, and don't keep up with the Joneses. This is America. We overspend. So that I tell everybody that, people, especially people younger than me in my generation, we really didn't do that early on. Mm-hmm. Don't overspend, because especially when you retire, what I've seen from talking to people, our retirement cost of living does not keep pace with active duty cost of living. Mm-hmm. So when I retired, I was making the same as someone who was higher ranked than me, and he retired 10 years before me. We were making the same. So you figure every 10, so
right.
Just don't get paranoid about it, but your income won't go as far probably 10 years from now, unless people like MOAA. That's where they come in for real. Yeah, don't keep up with the Joneses. It's freedom if you don't have a ridiculous amount of debt. If you're not paying $600 for a car every month, you got freedom.
Ain't that the truth?
Yeah. Just keeping the debt in check. And that's something I think that's an issue in our country that we could do better at.
Mm-hmm. That's a whole nother soapbox we could go on for a whole nother hour. That's another one about the system of keeping people oppressed with debt. But free yourself. That's why tiny homes are so amazing. And my dear friend, which I will, spoiler alert, I will talk about this more in the upcoming months, but my friend is the CEO of a company called Hub Kamal, and they are creating these, they call them chrysalis pods, but they are sustainable living pods. Oh. And they're kind of like the futuristic version of a tiny house.
Oh, nice.
That is really cool because they have aquaponics, and then you can grow food in the wall. So we'll get into more of that later, but, and they're extremely affordable too. And so as I get a little bit more involved with that more and more, I'll start sharing about that more on the podcast as well, because you know what? We need these things. If you can find a way to get yourself debt free, then you really are free.
Oh yeah. Yeah. There's a lot of freedom there. Mm-hmm.
Mm-hmm. And that's what we fought for.
That's right.
And that's what you served for as well. Right. So, well, I got to say, it's been such a great pleasure to meet you and talk to you and hear your story and learn about what it's like to be a public health services officer. And this has been an incredible experience and a great conversation. So thank you so much for being a guest.
Thank you. And it was nice meeting you. Thanks for having me. And in case people are wondering, the second non-military, non-armed service is NOAA, the National Oceanic and Atmospheric Association.
Oh, it's beautiful.
So it's now with the Space Force, the 6 armed services, and then NOAA and USPHS.
Wow. One big happy family.
Right. Yeah, but it was very nice. Thank you for having me on. I appreciate it. And hopefully our paths cross again. I have a feeling they will.
I'm sure of it.
Yes.
And if you would like to reach Kellie about getting a website done or some of those cybersecurity things, if you got bells and whistles going off when she said that, then I will put her contact information in the description box. As you know, I always do. That is where you read what the episode is about when you click onto it, and you just scroll down until you see all that information. Otherwise, you can always go to my website, thefemaleveteranspodcast.com, and send me a form, and I will respond to you as soon as possible with the information. Don't forget to follow me on Instagram at the Female Veterans Podcast. And I am on Twitter, not as often, but at FemVet Podcast. I kind of think Twitter's a little bit of a cesspool, so it's hard for me, but I'm trying to do better, you guys. So go follow me there. At FemVet Podcast, and keep listening, keep rating the episodes. Those good ratings. Thank you, by the way, for all of those ratings. I discovered a whole bunch more this past holiday, while I had time to actually look at that stuff. And thank you for that. And thank you for all the donations. And as always, you can find all of the organizations, the foundations that I'm supporting in the description box below the episode as well. So you can see who to go help if you so choose to, if you feel compelled to support some of these organizations. All their information is there as well. I did a whole little episode about supporting veteran businesses because we've got to support each other. We've got to help each other, which is why I shared about Kellie's business as well. So we're all we got. So we should be, we're out here supporting small businesses. We're out here supporting, all of these things. Let's support each other. Anyway, thank you for supporting me on this journey. I am so grateful. I love you guys, and I will talk to you next time.